Thanks, Gemma. Thanks, Kelly. And thanks, everyone, for joining the call today. Thanks for giving me the opportunity to talk to you about the HSE app. And we've got a short deck to run through, which will give you a kind of high-level overview of the program of work that we're doing and a little bit of information about the app. Hopefully, we won't dwell too long on the slides. I'm happy to take questions and kind of create a space or create an opportunity to have a conversation with you about it. Before we jump into the information about the app, I'd be interested to see if, by show of hands, if many people on the call actually have the app downloaded to their phones and are using it, or if I'm talking to people who are thinking about it, getting access to the app. If you're able to use the hands up icon there on Zoom, it might help us to figure that out. Okay, great. Well, look, anybody who's got any questions, hopefully I'll be able to answer them today. As I've said to Gemma, any questions that we won't be able to answer, I'll be happy to take away and get a response from you and follow up after the call. So, so I'll just jump into this is the short summary of what we're going to talk about. I'll tell you a bit about the process of designing the app, how many people are kind of using it currently, what's in the latest release of the app, and then I'll walk through some of the key features. And I'll ask you to bear with me because I've got a bit of a cold at the moment, so I'm occasionally taking a break to hack and cough. So the app is one of the first projects that's being delivered under Digital for Care, and Digital for Care is our digital health framework to 2030. The app is delivered under the principle of patient as an empowered partner. So the vision is to give you safe and secure access to your health data, to improve your experience of the health service, and then ultimately to improve your health and well-being. So we see the app as a conduit for the delivery of personalized data-driven services. We want to make sure that you have the information that you need to manage your healthcare. And the team I work with is the research and design team. And we're the team that deals most directly, I suppose, with working with patients and users of the app during the design process. The support of patients and people who rely on the app is critical to us. We do this in a number of ways. We conduct formal consultations with people like patient advocates and patient representatives, and we have a patient advisory group who are part of the formal governance of our project. And then the design process itself that we work through involves people at every stage. So we do a mix of research methods, one-to-one interviews, focus groups, co-design workshops, and then usability testing. So testing the app extensively with users and also monitoring feedback that we get to identify areas for improvement. So the involvement of people like yourselves and people who are using the app is critical to help us inform the decisions that are made around the functionality and the features. And our research team have built a database of insights from user research, which we use to support the planning, design, and development of the app. And our insights are carefully validated across multiple research exercises. So you can see on the screen here some of the key milestones that have taken place during the development of the app. So we started working in early 2023 with initial design workshops and an early proof of concept. We assembled a team and worked towards the delivery of a pilot in Cork University Maternity Hospital, which we delivered in 2024. So at that point, we had 36 maternity patients accessing their appointments and medications information through the app. And we had a further 63 people working within the HSE who had access to their data in the app. So through that process, we conducted extensive testing and research and interviews to understand how the app was working, how the experience was working, and making sure people could find their way around and use it. We made a number of changes and then worked towards our initial invite-only release, which took place towards the end of 2024. So over December and January, December 24 and January of this year, we extended our numbers of people on the app until we got about 1,500 people on there. Again, that allowed us to test the infrastructure and make sure that the app was performing well. And this was all in the run-up to our release in February of this year, where the app was launched by the Minister for Health in the Rotunda. We're due to have 3 releases this year, so that's after the initial launch. And we had the first of those, or the second rather, I suppose, version 2.0 of the app was released on May 26th. So this saw us extend some of the functionality in the app, mainly around collecting more data. So providing the first release of the app had the maternity appointments. The second release saw more appointments from some of the hospitals that we have appointments from, so the Coombe National Maternity Hospital and the Rotunda. And we also built in some additional functionality, allowing us to send push messages for appointment reminders, and also allowing us to share messages around appointments within the app. We made a number of accessibility and design improvements, which were based on the ongoing work we do around testing the app and collating feedback. And of course, we have the inevitable bug fixes, which we need to work through on an ongoing basis. So just to give you a sense of how many people are using the app at the moment, we have 69,310 verified users in the app. And verified users means it's not just the number of people who've downloaded, but this is people who've downloaded and logged in using MyGov ID. And those figures are correct as of the 17th of June. Of that number, just short of 12% of those are maternity users, and we're serving information on 42,932 appointments in the app across 19 sites. There's a breakdown you can see on screen of the entitlements that people are carrying in the app. So 54.7% of the people using the app have an EHIC card, 50.4% have the drug payment scheme, 10.6% have the GP visit card, 6% have the long-term illness card, and 30.5% have a medical card. And you can see we have records, 90%, or sorry, 88.9% of our verified users have vaccination record in the app, and there are records of 284,663 immunizations. And those are all for COVID and flu vaccines. The majority of the users in the app are aged between 25 and 44 at the moment, so that's about 38,000 of the users. And that's driven largely by the focus we've had on maternity appointments initially. So maternity patients are the people who would get the most value from the app at first release. We've focused our kind of the social media and marketing efforts on those users. And the acquisition of users since then has been slow and steady, with some notable spikes around media features or social spend. So you can see there was a spike in late April, which was associated with an article in the Irish Times, I believe. It's a deliberate plan to do a slow and steady rollout. Our plan is to bring additional people into the app when we can offer more value for them. So the more appointments that we add in and the more services that we add in, the more we'll extend out the kind of outreach to get people onto the app. So we would see that ramping up later this year and into next year. But with the app out in the wild, we have an opportunity now to get feedback. So as well as the research that we do, which is a big driver for the work that we're doing within the app, we're also listening to hear the sort of spontaneous feedback that we can get from within the ecosystem. The chart on the right of the screen shows some of the sources that we're tracking. The most feedback that we hear is through social listening. So that's listening out to what people are saying about the HSE app on social media like Facebook and X and those other channels. We also monitor feedback on the App Store, feedback which comes in through forums on our website, feedback which is received in HSE Live, and also feedback which we receive directly over email. So we're building up a database of these items. We've quite a low volume of spontaneous feedback. It would be in and around 500 items at the moment, but we are seeing some trends that we recognize from some of the research elsewhere. The biggest driver for feedback would probably be access issues and people experiencing problems logging into the app using MyGov ID. So obviously there's a high barrier of entry there around the need to verify your identity and go through that login process. We hear a lot about what we call proxy management. So this is people who might want to manage someone else's health. So it could be a parent wanting to know how and when they'll be able to manage their child's vaccinations, or someone who wants to manage someone who's a carer who wants to manage the health of someone that they're supporting through their care. And we hear a lot about people expecting to see more information in the app. So expecting to see their medical history, their complete medical records. We hear about self-declared information. So this is information that people want to give us or information that we're asking for from them. And then we hear about people's expectations around being able to manage data in the app. So people can see their appointments. The natural next step they feel is to be able to manage or cancel or reschedule appointments. And a lot of the feedback aligns with what we might have expected and with features that are on our roadmap. So it helps us to keep an eye on these and, make decisions around priorities when we're thinking about the next areas of focus for the teams. So I'll just give you a short walkthrough for the app for anyone who has it. Probably there might be some features here that you're not actively using, so hopefully this will be some use to you. So just to give you a quick overview, when you download the app for the first time, then we ask you to log in with MyGov ID. And this is so that we can safely identify you. And once you log in with MyGov ID, we match you to your IHI, which is the individual health identifier, and that number tracks you through the health system. It means we can go out to the various systems and retrieve your data, whether that's your entitlements like your EHIC and your medical card, or it's your appointments from a given hospital system. We've started, as I said earlier, with maternity appointments, and we're extending that out across the rest of the year. We have entitlements. I mentioned the EHIC, the medical card, the long-term illness card, the drugs payment scheme. We also have your vaccination records for COVID and flu. And then we're building out a set of services for which we call care supports, which are things like the quit plan. So supports we can provide you to help you change a behavior or to manage a condition. So we have a care support that we're building for pregnant people that will help them navigate their care and provide them timely information week by week as they navigate their pregnancy. We offer a number of features that you might find elsewhere in the ecosystem. So for example, you can access the urgent and emergency care finder that we have on the app so that you'll find the right place to go for care. And we also include information from our Health A to Z. So if you do have questions about a given condition, that you can find accessible, clinically validated information within the app. I mentioned that we ask you to log in with MyGov ID. We do make some of those basic features available to everybody. So if you do download the app from the App Store, but you don't have a verified MyGov ID, you can still open the app and take a look, and we'll include some of that signposting to some of those useful features within that channel. So we've mentioned appointments a few times, and appointments are one of the most important features in the app and one of the biggest focuses for the team. So at launch, we had appointments for expectant mothers within the app at the 19 maternity sites. As I said, we're starting now to extend that out over the course of the rest of this year. So first, we extended out to different types of appointments within 3 of the hospitals, and we're going around then to the different systems and integrating appointment data over the course of the year. So it's a huge effort there around ensuring that we've got the right data quality to share appointments with people. But this is going to be a huge focus for us over the rest of the year. It's noted here then that we'll be serving appointment notifications and reminders. That's something we included in that version 2 release. We're also building out helpful pre and post appointment information. So this is something we heard a lot from people we tested the app with. It's not just that they want to know when their appointment is, they want to know how to prepare for their appointment and maybe how they might need to prepare to recover afterwards. And this is feedback that we're sharing into the system so that we can develop that content and make sure that we can share it. We're working at the moment on the screening appointments. So we've started with breast check. So we should be integrating those appointments this year. And we're also looking at how we can surface your status on a wait list and integrate information on referrals that you'll have for appointments. So those two should be included later this year as well. Noted for the future then would be features like full self-management of appointments, so allowing you to reschedule an appointment or to cancel it, as long as that's clinically safe to do so. And then also integration of telehealth appointments would be on the future roadmap for this feature. One of the features that we've built in the app is a version of the My Medicines list. So My Medicines list is something that was developed by the HSE Safer Meds team. And the concept here is that there should be a patient health medication list that allows you to tell your care provider about the medicines and supplements that you might be taking. So the idea is that it's not just what you're prescribed or what's dispensed by a pharmacist. We also need to create a space for patients to tell us about the medications that they're taking from their perspective. So this feature can act as a memory aid. We will obviously be in future incorporating a more holistic view of medication, including prescriptions, which is on our longer term roadmap. So we took the opportunity to move ahead with this feature for the launch, and we'll be integrating it then with the kind of more holistic meds features in future. In terms of this feature specifically, we'll be looking to develop this to allow people to upload images, for example, of pill bottles, and also auto-populating the list using barcodes on packaging. We're looking at several other improvements around and enhancements around medication. So that will be a a big focus going into next year around allowing people to track medications and set reminders. We also have information on reimbursed medicines. So if you are on one of those existing schemes like the medical card or the drugs payment scheme and your medicines are reimbursed, you can see that data in the app. So you can see a record of the medicines that are reimbursed under those schemes. So on personal health information here, we're showing information about the vaccine records. So we mentioned that verified users of the app can access their COVID and flu vaccinations. This is another of the features that will be supported by notifications and reminders in future. So when you're due for vaccinations, we're working to extend out the health data that we'll include. So that will include information from your shared care record, scans, tests, and labs results. Excuse me, scans, tests, and lab results. And that's something that we're working on extensively at the moment to ensure that we can make that information comprehensible to people. In terms of vaccines, I think we have a question around that already. We don't have additional vaccines on the roadmap for this year, but we will be extending and integrating further vaccine information next year and into the future. And then card schemes and identity. So one of the big pieces of work that we did originally was that integration with MyGov ID. So we've effectively in the background created a new form of digital identity for the health service, which combines your PPS and your IHI and allows us to create a credential that can retrieve information from the various systems and make it available to you. We're able to serve your EHIC, your LTI, long-term illness card, your medical card, GP visit card and drugs payment scheme currently. Again, this will be something that will be supported by our reminders and notification features when it comes to expiry of those entitlements. And we'll be looking at a future integration with the government digital wallet project, which is up and running. Some of the future use cases here is that we would see the facility for people to use the app to check in at a healthcare facility. So the fact that we're able to share your information in a contactless way, we'll be looking in future to be able to make it possible for you to walk into a hospital and verify your identity using your phone, so you don't have to repeat ad infinitum your name and address and your personal information. We'd also like to improve work with the various stakeholders to improve the application processes for those various entitlements. And then you can see on the screen some of the general health information services and communications that we provide. So in the app at the moment, we provide support from HSE Live. So it's another way for us to do that. We give you access to the Health A to Z, which is a hugely popular feature on our website. We include our care finders. So our urgent and emergency care finder, for example, we've recently included the HRT finder. So you can find a pharmacy giving free HRT. And we include various self-care and well-being information. We're working on the launch of our quit smoking service within the app. So that should be in the next release of the app. So you'll be able to sign up for help to quit smoking. We're developing a new physical activity care support. So this is a plan that will help people who are inactive. It will help them get back to a basic aerobic fitness campaign over a course of 10 weeks. We're working on a plan to share information for people with diabetes. So we have a service that we offer via the website at the moment, which gives you kind of a year's worth of information, week by week or month by month. And we'll be looking to integrate that into the app experience. likewise, we have a similar service for pregnant people. And we're working with the NCCP on a new service that supports people in their recovery. It's currently for prostate cancer at a number of limited sites, but these are services that we're working with frontline care providers to develop so that the app can be part of empowering people to manage some aspects of their own care. In future, we'd see the delivery of personalized care plans through the app, so based on your data, and providing easier opportunities to communicate through the app with your healthcare team and with HSE services. So I've mentioned over the course of the call so far some of the features that we're working on, and some of those are recapped here. Big focus for the team at the moment is on we call digital health literacy. So we want to present all of your health data within the app. We want to make sure as well that that information is accessible and easy to understand, and to test the ways that we're doing that with the people who use the app. We have plans to integrate with the chronic disease management program, to integrate data from that systems, and then also to develop the kind of supporting information that can help those patients. Referrals and wait times for care, I've already referred to, the extension of the appointment data, and we're continually working on enhancements and improvements. So as we learn more about people's experience of the app, we learn more about the things we need to do better. So we're working through enhancements and changes and upgrades to different features as we go. So I hope that was a useful overview of the app. I'm happy to take any questions, Gemma, or if you want to act as the mediator.